Grüezi ragazzi, bienvenue e welcome to Cannabis Scienza's LinkedIn Live for this week. To those of you joining us live, thank you very much for joining us. And to those of you who will be checking out the recording at a later time, also a big thank you to you. We hope you enjoy it, and hopefully you will have left today's session having learned something new. A quick intro about us. Cannabis Scienza aims to combat the bottlenecks of the medical cannabis industry using the power of education and through the training of healthcare professionals on the effective use of cannabinoid medicines. In doing so, doing our part to increase access to medical cannabis for patients worldwide. On your screen right now, you actually see an overview of the services that we offer, as well as a QR code you can scan if you'd like to get in touch with us. Now, something that we're really excited about, and we happen to have one of our contributors with us today, is the launch of our Principles of Clinical Cannabinology Handbook. It's just around the corner. Amongst other things, it covers the endocannabinoid system, clinical practices, regulatory landscapes, as well as available products in different jurisdictions. If you're interested in learning more about the handbook, reserving your copy, or also learning about sponsorship opportunities, please scan the QR code that's on your screen now and get in touch with us. Last but not least, if you haven't already, please head over to the Cannabis Scienza LinkedIn page and hit that follow button. We have crossed the 1,000 followers mark, and we do have something exciting planned, which we're going to announce very soon. And enough with my monologue now. I'm very happy to be joined today by our guest, Jean-Claude Scicluna, MD and Chief Science Officer out of Malta, and he is joining us today to discuss medical cannabis and research in Malta. So first of all, Jean-Claude, thank you very much for joining us. And you have a lovely background today. I was saying before we got started, you probably have the nicest background anyone has had on our lives yet. If I may please ask you to maybe start by just giving us a little bit of an intro about yourself, that would be great.
Sure thing. First of all, thanks for having me. Thanks, Cannabis Scienza. I think what you're doing is great. And I'd love to continue spreading awareness, education, and insights amongst us doctors, cannabis doctors, and plant medicine in general. I am currently in the French Pyrenees, so that explains the background. But I am based as a clinician in Malta, where I founded my clinic, Plant Medicine Clinics, something that started from Malta Cannabis Clinic, being the first openly in cannabis clinic on the island, and later also it grew and developed as I grew and developed from cannabis and into also other aspects of plant medicine. I'm also an academic. I'm a neuroscientist. I'm finishing off my PhD at the University of Malta, and I am looking into fibromyalgia, cannabis, and the microbiome, and exploring those three aspects and seeing where they intersect for fibromyalgia patients and to a greater extent every patient who we look at now as neurodivergent. So neurodivergency and conditions which are neurodivergent are huge, and the study looks into fibromyalgia and the microbiome and cannabis as possible new and novel both biomarkers and therapies to improve the lives of fibromyalgia, which affects an increasing number of people around the globe.
Thank you, Jean-Claude. Perhaps we could begin our conversation today by you just giving us an overview of the lay of the land in Malta at the moment as far as medical cannabis is concerned. We were speaking a little bit before we started. Perhaps you could tell us about since when medical cannabis has been a treatment option for physicians and kind of how that's transitioned over the last few years.
Right. So medical cannabis in Malta has been legal since 2018. So we're 5 years into the making now. Recreational cannabis curiously has followed along. So last year, new legislation has passed, and more earlier this year, the new Cannabis Authority for Responsible Cannabis Use in Malta has actually published guidelines for harm reduction in cannabis growing associations. So now we're actually seeing for the first time ever in Europe two fully legal recreational and medical sectors working in tandem, which I think is interesting from a scientific aspect, if nothing else. With regards to medical cannabis, unfortunately, despite now 5 years down the line, the industry remains very, very small and quite limited. And when I talk about the medical cannabis industry, I look at it as any healthcare industry should be seen, in my opinion, which is from a patient access and from a patient-centric point of view. And 5 years down the line, and patients in Malta still struggle to find cannabis access. Um, so in Malta, there is an existing system where a patient can, through a licensed MD, which can be any licensed MD and doesn't need to be a specialist, it could be a family practitioner, can apply indirectly to be able to use medical cannabis in Malta through their doctor. So the patient would go to their doctor. The doctor would submit an application. First of all, a primary application, which licenses for a 1 month usage permit for medical cannabis, which can then be renewed again through the doctor for 6 month intervals. And then every 6 months, the medical permit can be renewed. There are no stipulated indications for medical cannabis, so the indication is completely up to the doctor. Normally, medical cannabis is used not in acute situations, but rather in chronic situations. So we look at the biggest indications normally would have to do with chronic pain, which classically, even in Malta, as I'm sure other territories, chronic pain is popular, and patients have already been accustomed to the fact that cannabis is an option there. But also, especially in Malta, where any indication can technically be approved, we see patients using medical cannabis for a variety of different indications. So this goes from orthopedic, rheumatological aspects such as osteoarthritis, fibromyalgia, to even women's health, endometriosis, and everything in between. So really in Malta, it's brilliant, and again, it's from a scientific point of view very interesting because you have a lot of range and a lot of variety of why patients are turning to cannabis, and especially knowing all the research that's coming out now, and we have so much research coming at us with cannabis for this indication, cannabis for that indication. Really, cannabis, like other plants, and unlike the traditional medicines which have been popular since the 20th century, cannabis is really a one-to-many solution for many ailments. Problem is that although cannabis access, so access to the plant, has increased, especially in terms of availability at pharmacies, the access to cannabis care is not really that open. So it is there are very limited number of prescribing doctors in cannabis. So a recent census by the Public Health Authority showed that it was a total number of around 40 doctors who have prescribed cannabis at least once in Malta. And when you remove doctors who have prescribed normally on 5 instances or less, so we're looking at doctors who are more routinely or more in a specialist manner prescribing cannabis, this number falls down to much less. So we're talking around 10 or a bit less than 10. And this serves as a partial barrier to access. So the point I'd like to make here is, from a legal standpoint, a lot of things have happened, but in practice, we still, like other countries, have this phenomenon, I'd like to call it, where doctors are still not prescribing cannabis.
Why do you think that doctors are not prescribing cannabis in Malta like in other part of Europe? Because it's the same situation you describing. We know we talk with the physician from Germany or other country, and they face the same problem. Why do you think there are so few people, a small number of people, or a medical doctor prescribing cannabis?
That's a great question, Fabio. Ultimately, when the clinical decision is there to prescribe cannabis or not, or to prescribe any medicine really or not, the doctor has to look at two things: the indication, but moreover, their own professional knowledge and how comfortable they are with prescribing the drug. So we see many instances where medicines that haven't really filtered into the doctor's general practice, especially ones which aren't available in general hospitals, which are normally the first ground for doctors, even as they're training, cannabis isn't there. And cannabis knowledge and cannabis education wasn't present in medical school. So looking at it from firstly a patient perspective and keeping the safety of the patient, and secondly legal and professional indemnity aspect, many doctors, simply put, don't feel comfortable to prescribe cannabis. This is something I've spoken with many colleagues in various sectors, from pediatrics, obs and gynae, and many tell me that, listen, I see the research, I see your research. It's not a case of not believing in it or not seeing the science. I think many doctors are trained well enough to see and understand the science. However, the speciality training needed to feel comfortable to prescribe in the patient doctor scenario, which is a very delicate scenario, is not there. So this ultimately it creates a vacuum, and this is why I decided about a year ago to broaden my horizons and to work on this problem. And so ever since now almost a year, I've been working as a chief science in a startup where we are trying to give doctors that extra arsenal and those extra tools they can use to prescribe cannabis with confidence. Because like any medicine, the doctor needs to be sure and confident that they're going to prescribe something that is not going to harm the patient, first of all, primum non nocere, as we say in medicine, first do no harm. And secondly, we want to make sure that the patient gets a good outcome. I think any clinician, if you had to ask them, what's your bottom line in the patient-doctor relationship, it is that the patient leaves feeling satisfied at the service, feeling listened to, and at the end of the day, leaves your clinic in a better state than they came. So this is something which we really look at doing, and empowering the doctor to be more confident to prescribe cannabis is essential, especially when you remember that cannabis is very, very specific. So the cannabis you will be prescribing for a patient, an indication in, say, women's health, gynecology, will be different to the type of cannabis and the type of vehicle you use to take your cannabis for another problem, such as mental health or such as physical pain. So there are these gaps, and there are certain points between the stakeholders, I feel, where there's a lack of a loop or joining of a loop. So this is something that at Celotex I'm working hard to speak to doctors, network with doctors, and solve these gaps, because more than anything, I want to see more knowledgeable doctors and more access. It's one of those industries where every cannabis doctor I've spoken to prays for more peers, and it's amazing when you meet other peers and you can share insights, you can share stories, clinical stories, what went right, what didn't go so right, how I can improve. Like every other field, medicine has been always like this, where doctors choose which fellowship or which department they work in. And more than anything else, I think cannabis needs to have one and be connected with other departments, which I feel is also a problem cannabis doctors face, that many a time doctors from other departments aren't ready to speak with us, aren't ready to discuss patients, and this is not nice. But more importantly than that, it can be unsafe. So one example I'll give is um, um, anesthesia and patients that I treat prior to surgery. Normally, cannabis medicine either is ignored or also discussing their cannabis medicine is refused outright by a colleague at a general hospital. And obviously, this does nothing but put the patient in, at the worst case scenario, a dangerous situation, and at the best case scenario, certainly an uncomfortable one.
Yeah, I think you touched the point, the very good point, because I think one of the most important things to consider is that medical doctors are not well educated about medical cannabis. I mean, during their academic studies, because medical cannabis in universities is not treated specifically. Maybe you can find someone talking about medical cannabis just from the botanical aspects or just as a drug, nor as a medication that has a lot of effects. So education, I think, it's one of the first problem, as you said. Moreover, there is also the fact that medical doctors are used to prescribe drugs for which they know the exact dosage. They read the instruction, the sheet, and they follow the rules. Obviously, it's a very good thing that medical doctors do, but it's impossible to do it in every case with the medical cannabis, because we know that the cannabis is a personalized medicine. So we need to find the right dosage for each people and for each condition. So as you said, maybe these are the challenge that medical cannabis industry need to overcome in the next few years.
Absolutely, Fabio, and this is what I'm talking about. You know, we go to a radiologist, and he's using tech. He's using very tech. We go to any, you know, even the most basic point of care um, uh, areas or outposts. I'm not talking general hospitals here, but they're using tech and they're using um, uh, things which ultimately help the doctor and help any healthcare staff give a better service. And this is why we need these two elements. For me, they go hand in hand and they're so important. Yes, we need more tech to help doctors, like we're doing at Celotex, and we need more education. We need more publications, like what Cannabis Science are doing and the book they're releasing, sharing insights, sharing clinical cases. This is how any profession grows. This is how any specialty in medicine grows. And cannabis is no different. Certainly, it had some pushback because of a variety of issues. I think also the Cannabis Science audience is very well versed with the history of cannabis and how this history, this illicit history, kept it somewhat distant from the hospitals and from the educational curricula of the past. But the past is the past, and this is why it's important that we embrace education and we embrace tech now, not just in cannabis. I love saying this. The more I grow and develop, the more I see that even with other specialties, alternative medicine, professionals, colleagues who we've been giving the cold shoulder, sometimes I say in Western medicine, we really need to unite, and we need to embrace other forms of medicine, especially in the West. I feel that we need to become more open to newer therapies, and we need to embrace the fact that research in these areas is going at such a fast pace that it is an excuse really to hide behind the excuse that there aren't enough clinical trials. If you had to look, you know, specialty by specialty, you'd see that in some aspects there are more than enough trials. One can see that the amount of research that has happened in the past 3 years, by volume at least, eclipsed what happened in the previous 10, which is amazing. from a scientific point of view, but from a medical point of view, I think it's important that we're mature and we move forward, both as clinicians, but also as educational institutions and governments. We move forward in an evidence-based, open manner, which is ultimately not to save face or ego of any professional or colleague, but ultimately this is all being done with the aim of holistic care in a patient-centric manner, right?
Yes, of course. Yeah, I completely agree with you. If we are waiting for randomized controlled clinical trials indicating that medical cannabis is in works for a particular condition. Maybe we will wait forever, because a lot of clinical trials have been done, but maybe results are not so effective. But maybe it's the problem is with the clinical trial itself that cannot go us any advice about the real world experience that we have. A huge amount of clinical real world experience from medical cannabis. So maybe also regulatory systems, regulatory processes should take care about the real world evidences about medical cannabis. Of course, randomized clinical trials are necessary. We need to know what is really happening, because they can avoid any bias on the research, but also real world data, small clinical trials, case studies are really worth in the medical cannabis industry. And regarding this, you, Jean-Claude, shared with us in our handbook, as you mentioned, some really interesting cases on how you effectively treat patients with medical cannabis. Especially one of these cases was regarding a patient with a cluster headache. Can you describe also for our audience this case, and can you tell us more about these patients? How do you treat
Fabio. Certainly, Fabio. On the previous note, I agree 100%. We are not against, randomized clinical trials, but
Never.
it is the epitome. It is the epitome of a body of work, which often goes unnoticed. It's easy to look at a clinical trial in a big journal and say, this happened. But before that and behind that article comes years and years and years of observational data, of off-label use, and many. In the US, at least 1 in 5 of prescriptions round all around, all across, is off-label. So it's a medicine which actually wasn't indicated by an RCT, by a clinical trial for that indication. Regarding the case, a 31-year-old gentleman, still in contact, doing very well now, suffering from cluster headaches for a number of years. So since his early teens, he had been suffering from headaches for a number of years, and it was very treatment resistant. So he had gone through the whole list of medications. Interestingly enough, what seemed to be the best treatment for abortive therapy, so that is to say that during the cluster headache, how to abort or remove the cluster headache, he was totally treatment resistant except for oxygen therapy. In fact, the patient was used to driving around 15 minutes to the nearest health center to get some oxygen therapy from the oxygen tank, which obviously is efficient for the patient, but wasn't practical at all. Moreover, the frequency was very disturbing. So he was getting a number of cluster headaches a week, and going for months, and sometimes it would be 10 months or close to a year without a break, so without any remission. So this obviously affects the patient, not just because of the pain of the headache, but also emotional burden, social burden, hours lost of work. With medical cannabis, we started gently. I like to start patients, first of all, especially they aren't or don't have a lot of cannabis experience with some CBD. So before I start using more psychoactive substances, I first of all have a conversation with the patient to see how comfortable they are with taking narcotics. This patient had previous cannabis experience, but preferred to go slow. He'd been suffering for ages anyway. And we started off with CBD in the form of oil, which didn't really have any effect. So we quickly then progressed to THC, and this time went on a flower, and this is a THC CBD 1-to-1 ratio. And in a matter of 2 weeks, we effectively managed to halt, at least for the time being, the constant migraine attacks. So in 2 weeks, after therapy, we already had a sort of small remission. The 1-to-1 ratio worked very well to distance attacks. However, abortive treatment, when he was in a cluster headache, it wasn't working that strong, and that is when we tried to shift the balance a bit more towards THC.
Excuse me, excuse me, Shankar. Which route of administration you used?
Right. So we started off with oil. However, we then quickly moved to flower. So we were using a balanced THC CBD flower. And as I was saying, then for abortive therapy, we used THC dominant flower. This was normally used by the patient either at nighttime or in the case of really bad attacks, also during the daytime when the patient wasn't at work. So if it was a day where the cluster headache was too bad, the patient would just stay at home, a sick day, and also use high THC flower, which effectively decreased the cluster headache. And for the most part, except for the most serious attacks, which still required oxygen therapy for the patient, this combination worked very well. The results are even more provoking when you think, when you look at the frequency. And I think this is where we achieved the biggest result, that from having multiple attacks in a week, the patient went average of 4 to 6 months without an attack. And for us, maybe this is a number or a duration of time or something to perhaps write a case report, but let's not forget that for this patient, this is a life-changing outcome. We look at cannabis sometimes as not being curative or not solving issues. However, in chronic issues, I'm not going to say chronic pain because it could be chronic anything, the patient's quality of life is important, and making a difference for the patient isn't necessarily removing, definitely not in neurodivergent conditions, which can be genetic, but the goal is ultimately to make the patient's life better, to increase that quality of life.
Yeah, did she experience any side effects during the treatment?
Not at all. It was a very smooth, the patient reported it was very smooth using the medicine. What helped is the fact that they already had cannabis experience in the past. So they had used, although not usually, but they had used, especially earlier on in their 20s, cannabis recreationally. And this gave the patients, rather than anything biological benefit, but it gave the patient a bit of knowledge of how to use and get around the plant. Especially flower can be difficult for patients with no experience, patients who are a bit older or maybe suffer from arthritic conditions in their hands, especially to open packaging and grinding. Flower remains very, very much of an obstacle for patients, and this is why I advocate, especially with cannabis companies that I consult and speak to try and create easier methods for patients to take their medicine, because flower remains a bit of a
difficult, yeah,
call it whatever you want. Yeah, for the
for patients.
person
Yes.
who enjoys, yeah.
This is actually the perfect segue. First of all, exactly what you're saying is missing for physicians to have something to reference to make the transition to working with cannabinoids easier. I mean, chapeau to you, because this is exactly what you're doing and what we aim to do in our work together. And actually, what you just mentioned about the difficulty with flowers is the perfect segue to a question that we have, and then we also already hit our time limit. But Andrew David Petronanos asked, when prescribing flowers, how can you standardize the dosage when the flower is vaporized? Meaning making sure that the cannabinoid intake is constant and standardized.
Yeah, that's a great question, Andrew. Ultimately, this is where I spoke earlier how education and tech need to go hand in hand. And this is exactly one of those cases. So, like Cannabis are doing, we need to educate doctors more about cannabis in different specialities and cannabis being used for different things, and writing things down, collaborating, networking, and issuing more publications like the one we spoke about earlier, and tech. Technology is important also in alternative medicine, also in cannabis. This is something that I'm working on fully with Celotex, of trying to give doctors the dosage calculation required in different instances. So doctors can be more confident when they're prescribing across the border. We're looking at a lot of doctors now getting into cannabis, and this is something which benefits cannabis. A lot of doctors are coming in from different specialities. I knew someone who was a specialist in endocrinology, someone else, diabetes medicine, women's health, and they're coming into cannabis and they're being more devoted into cannabis. And these specialities are good for us, but we also need to help doctors coming from different backgrounds to dose their medicines, and to help patients understand that doctor-patient relationship, that those instructions ultimately. Let's not forget, we talk a lot about doctors, but I also want to mention the other important professionals in healthcare, namely pharmacists, who are the essential element, because they are the final connection of the medicine. The patient came to me, we had a discussion, the patient is understanding maybe a bit more about the medicine and how it can help him, but this patient is then leaving my clinic and going to the pharmacist, and a lot of the patient's outcomes depends not only on the communication between myself and the patient and my prescription, but also the communication between the patient and the pharmacist, and my communication with the pharmacist via the prescription. So at Celotex, we're developing tech to help that prescription happen. Actually, one of our devices that we're cooking up is a configurator for prescriptions, which will help doctors know where to start when titrating cannabis, depending on various health parameters of the patients. Other tech also includes interactions checking. We scan also patients' medical history for drug interactions, and amongst these also assess the patient outcome. With patient outcomes, it's sometimes difficult when a patient comes back to you and you ask, the vital question: how was it? How did you do? Was it good? Was it bad? And whilst it's sacrosanct, it's very important to develop a rapport and speak to patients. It's also important to have data, and doctors need data, and pharmacists need data to know what is working and what isn't working. And this is the kind of tech we're working on. It needs to be hand in hand with education, with insights, and with collaboration between doctors, because, like we said, we're very, and we need to grow.
We know very well, especially here in Cannabis, we are here to educate people, medical doctors, pharmacists, nurses, that are also very important in medical cannabis process, and anyone who needs to understand and learn more about medical cannabis.
Absolutely. I'm glad you mentioned the pharmacists as well, Jean-Claude, because here in Germany also, I mean, the fact of the matter is the pharmacists are just often more easily accessible to the patients than the doctor is. And so they are an extremely valuable source of information and a partner for the patients as well. So if you guys enjoyed today's session, if you want to learn more about medical cannabis and research in Malta, you guys can always leave a comment on the event. Jean-Claude or one of the Cannabis Scienza team members will definitely get back to you. And if you like the example that Jean-Claude made and the kind of framework to the case study that he described, we have a bunch of those in our upcoming Principles of Clinical Cannabinology handbook, including another one from Jean-Claude as well. So on that note, I'd like to thank everybody that tuned in today. Thank you also if you're tuning in at a later time. Jean-Claude, thank you very much for joining us today. I definitely think we have to have another session, maybe also to do another deeper dive on the tech side. But thank you very much for your time. And man, enjoy the rest of your day in beautiful France.
Thank you.
Goodbye.
Thank you for having me. Thank you.
Goodbye to everyone.
Thank you.
Bye.